We're glad that you're here today. Parents Helping Parents supports families raising children with special needs in Silicon Valley and beyond. Today, I'd like to thank San Andreas Regional Center, the Friends of Children with Special Needs, Silicon Valley Independent Living Center, and Healthier Kids Foundation for co-sponsoring today's town hall, but also for being partners with us on the Santa Clara County Vaccine Stakeholders Group for People with Disabilities. And we meet with public health regularly to advocate and get accurate information for the disability community. So today's town hall is focusing on the disability community and the COVID-19 vaccine here in Santa Clara County. Our presenter today is Dr. Marty Fenstersheib, the COVID testing officer for Santa Clara County, managing testing and vaccine distribution. For those of you who are joining us today from outside of Santa Clara County, some of the information may be relevant, but you may need to check with your health department for actual information for your own circumstances. Also on this call, we are fortunate to have Rhonda, Jennifer, and Brian from the Public Health Department who will be responding via chat to public health questions. So if you put your concerns and questions in the Q&A, not only will they be asked to Dr. Marty, but also you may get responses directly from staff at the Public Health Department. Our moderator today, we're fortunate to have Sherry Burns joining us. She's the Executive Director of Silicon Valley Independent Living Center. And she tells me she's a quick reader. So she's gonna be reading your Q&A as fast as she can so that she can ask good questions on your behalf. So thank you, Dr. Fenstersheib, for joining us and meeting with our community today.
Okay, great. Just make sure that you can hear me all right.
Yes.
Yes? Okay. When I didn't hear something back, I was worried that I had the mute on, but I'm okay. All right, well, thank you and welcome to everybody here today. I was asked to provide a brief presentation to get things going, and that we would really allow most of the time for questions and discussions. So that's what we plan to do today. So let's start with our first slide. And again, there's so much information. I can't possibly provide everything, but I want to give you a snapshot basically of the vaccine situation here in Santa Clara County. So right now, as probably most of you know, there are two current vaccines available, and they are the Pfizer vaccine and the Moderna vaccine, and they're very similar. The technology for producing them is the same. There are other vaccines in the pipeline, and another one I'll talk about in a moment that is a little bit different in the way it was produced. The effectiveness, though, of the two vaccines, the Pfizer and the Moderna, is very, very high. And you can see from the slide here that the Pfizer is 95% effective and the Moderna 94%, so pretty much the same. When they say effectiveness, though, when they actually developed the vaccines and tested them, the 95 or 94% effectiveness really is telling us that they will prevent moderate or severe illness, and that's how they determine the effectiveness. We're still learning more about how well they can prevent us from actually getting any infection or transmitting the infection to anyone else. We assume and hope that in time, as we see more and more people and have more data, we will be able to say with certainty that these vaccines actually prevent transmission. But at this point, the effectiveness is that if you get vaccinated, that you are pretty assured that you will not end up with any significant level of the disease. These vaccines are, no, let's go back. Go back to the first. Okay, the vaccines are very, very safe. We've already said that they were very effective, very, very safe. And all of the studies that had tens of thousands of people in them really showed how safe they were. And in fact, most of the vaccines only cause minimal side effects. And those side effects include a little bit of local soreness in the arm that you get the vaccine, and that soreness may last for a day or two. You may get a little swelling, you may get a little redness also. Some of the perhaps a little bit more significant side effects you may experience again after a vaccine shot would be the fatigue, sometimes a little bit of headache, maybe some chills or tiredness. And that also lasts for a very short amount of time, maybe 1 day to 2 days. As far as other more significant reactions, those are very, very rare. And those are mainly in people who have had experienced significant reactions previously to other vaccines, and that causes them to develop an anaphylaxis reaction, which basically is a severe allergic reaction, which causes people to have breathing problems, and then they have to use their EpiPen or their medication to reverse that reaction. But very, 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 very rare. And when I say allergies, it does not include allergies to food or seasonal allergies like asthma. Those are not contraindications, meaning that you can be vaccinated. There's hardly any contraindications to these vaccines. They are both 2-dose vaccines, and the Pfizer requires you to have the second dose 3 weeks after your first dose, and the Moderna vaccine is a little bit longer, 4 weeks. After you get the first dose of Moderna, you get the second dose of Moderna vaccine. People say, which is better? They're both the same. Both of these vaccines are absolutely the same. I don't have a slide on the new vaccine that was just authorized by the FDA, which just happened over the weekend, and that's the Johnson & Johnson vaccine. More to come on that, but it was authorized for emergency use. And will be rolling out this week. Now, the difference in that vaccine is that the technology for developing it is not the same as the Moderna and Pfizer. It's a little bit more traditional in the way it was developed, kind of like our flu vaccines, the same type of development. And the big news is it's a 1-dose vaccine. So once you get it, you're done. The side effects, as I remember seeing from the initial excuse me, from the initial trials, were that it was also safe. Excuse me. Anyway, it's a safe vaccine also, and the Johnson & Johnson vaccine is also, as I said, a single dose. Its effectiveness, you'll probably hear, and people may start talking about its effectiveness because it was also shown to be highly effective, but the numbers are a little bit lower. So don't be fooled by saying I don't want that vaccine. It's an inferior vaccine. It is an excellent vaccine and will prevent any significant or moderate illnesses. So any vaccine basically that's offered, we take, because they're all excellent vaccines. But more to come on the Johnson & Johnson. I just wanted to kind of cover that so everybody is on the same level playing field in discussing the vaccines. Okay, let's go on now that we know everything about the vaccine. We'll move on to the next slide, which shows you the eligibility criteria. And we'll talk a lot about this because I think, especially in our discussions about disabilities and caretakers, we will delve into the eligibility criteria. When these vaccines rolled out, which occurred, I think our first vaccine dose was given on December 17th, as I remember, and we were vaccinating people in what we called phase 1A. And these phases were determined by the federal government, the CDC, and also the state. The local people have nothing to say in developing these phases. They're all given to us ahead of time. So phase 1A included all those that work in healthcare. And so we'll talk more about that later, but it's basically all the healthcare, a very large group of people in the health field, and also included residents of skilled nursing homes and long-term care facilities. So that was phase 1A, those two groups. Then we moved into phase 1B, and I will be giving a little bit more detail in a little bit, but the next phase that we're in now, phase 1B, involved initially individuals of a certain age, and it was pretty much our senior citizens. We started off with people 75 and older, and then we moved down to 65 and older. So that was the initial part of that phase 1B. And now we have just moved, effective, what's today, Tuesday, so Sunday, the 28th, we started to move into the next sector. And that includes 3 different areas. As you can see, agriculture and food. And so that's our agricultural workers that are in the fields working and producing and making food. And also people that actually work in the food business, in restaurants, takeout, and also people that are involved in helping various food drives, and such as Second Harvest and others. People that are actually volunteering are all included in that. And then the second is the education sector and childcare, and that involves all of the teachers and people taking care of children and others, and also people in schools that are helping to make sure the school runs, like the janitors, the people working in food service, the administrators. So all of those are included in that second category. And then finally, the emergency service workers who are also in that particular category. So that's where we are now. And let's go on to the next slide, which I think so I'm expanding. I'm going to expand on what I just said. So phase 1A, as I said, was the first group. And you can see that was healthcare workers, as I mentioned, and long-term care residents. We initially had rolled this out in 3 tiers. The 3 tiers really don't apply anymore. So it's anybody in this phase 1A. And again, people that initially are in this phase that didn't know it or were hesitant about getting the vaccine and now decided that they want it can still get the vaccine. So phase 1A is still workable and people can still come in who are members of phase 1A. And you can see that there's a large number of groups initially. Most of all, we had been doing people that were working in hospitals, skilled nursing homes. And then as you go down, you can see we then moved to high-risk congregate care settings, and then also intermediate care facilities and persons who are actually in healthcare or home healthcare and supportive services, including IHSS workers. So again, a number of the categories we're going to talk about today that probably a lot of you are interested in actually are in this phase 1A. Community health workers, and again, a lot of people that are providing home and health care to individuals in their home or in another home. So again, you can look down that list and see all that's included when I talked about phase 1A. Let's go on to the next slide. And again, just expanding on what I said about that next phase 1B, those sectors, the food and agriculture, and you can see basically a list of what I described initially, and pay attention there to the education and childcare, because again, maybe that's probably an area that we'll spend more time on. But you can see, as I mentioned, workers supporting private and public education and childcare establishments, all the way from pre-K all the way through colleges and universities. So that's all included. And again, as you see, provisions for those providing meals and supervision instructions, and also the administration of the hospital. And then emergency service workers, again, a long list of people involved in law enforcement and emergency services and search and rescue and all of those others that are listed in that group. So that's where we are to this point. So just take that all in, phase 1A, phase 1B. And that's at this present time, we are vaccinating everybody in both of those phases. Next slide. So in the coming weeks, and the governor made mention of an expansion of where we are, all of those that we just talked about. The governor mentioned that we would be moving to expanding who we're vaccinating, and that will occur sometime in the middle of March. It could be delayed. It depends again on how much vaccine we've gotten. But the next group, I should say, will involve people who are between 16 and 64. And the reason, which I didn't mention initially, was the vaccines are only been approved for those individuals 16 and older. So 16 and below 16, the vaccines are not indicated. They weren't tested for that, and they haven't been approved for young people at this point, adolescents or younger. They are, I should say that the companies the two manufacturers of Moderna and Pfizer are actually looking at extending some trials to include adolescents between 12 and 15. That's just getting underway, and I don't know exactly when we will have information or when they would get an approval for those adolescents. But right now, vaccines, we can only give vaccines to those 16 and older. So this expansion in the middle of March, then it would include people 16 and to 64, or basically 16 and older, with high-risk conditions. And the list of chronic conditions that you see there is something that was provided by the state. This could change. It could be, we could get additional information. Additional conditions could be indicated or added to this list in the future. But we're not quite there yet, but we are preparing so that you know what's next after we finish with the phase 1B at this point. Let's move on. So we were just talking about getting into, again, some of the eligibility, and I know that a lot of the questions will revolve around caregiver vaccinations. And so I wanted to just put it out right at the beginning here to indicate that caregivers, and we say basically family members who are caregivers and who may care for a regional center enrollee, are all eligible as healthcare workers. Remember that phase 1A had healthcare workers. And so caregivers, family members who are caregivers can be vaccinated under that phase 1A. Family members also who provide significant in-person care for another household family member or household member or a family member with a disability are also eligible in that phase 1A. So you would sign up as a healthcare worker. And so you would be eligible at this point. And then I already mentioned IHSS workers, a different a group of workers who have that type of certification. And we have reached out, and hopefully all of the IHSS workers have been made aware of their eligibility to receive vaccine, again, as a healthcare worker. Let's move on. So people are asking us, okay, well, so what do I have to show or to prove or bring, to basically prove that I'm eligible for vaccine? And so the state's made it a little complicated. When we first did the phase 1A that we talked about, healthcare workers, it's basically was determined, we were allocated vaccine by the people that were working in our community. The number that we got included people that necessarily didn't just live in our community, but who also worked in our community. So we vaccinated everybody that lives or works in the community that fit into phase 1A. When we moved to phase 1B, the first part of that, when I talked about the 65 and older, the state said, well, we know what the numbers are for your community of people who are 65 and older who live in your community. So then we moved for that particular group that's determined by age to basically say you have to show us that you are of that age and that you live in our county. Everyone is required to sign an attestation, and that basically just means that you're providing truthful information. So at this point, to be clear, because I don't want to confuse people, but if for 65 and older, for an age-based determination, you have to show that you actually live in our community, in this community, and document your age. If you're in phase 1A, or as we move further into those other chronic care condition eligibility, and also all of the teachers, food and ag, restaurant workers, again, the occupations, they also are okay to be either living here or working here. So it's pretty much live or work in our county, unless it's just by your age, and then you just have to be, you're eligible by the fact that you actually live in our community. As far as documentation, we know that it's not always easy to get documentation, so we're pretty much accepting most forms of documentation, a letter, a note from an employer, even from someone in the household that can attest to the fact that you're providing childcare or care to somebody in your household. Maybe your employer, if you work at the regional, if you have a family member from the regional center, that you get a note also. So we're not making this too difficult, but we have to really have to see something that can at least keep our numbers so that we are utilizing the vaccine that we have been given strictly for the population that either lives or works in our community. And again, as I said, sometimes it's the attestation again, it says under penalty of perjury or whatever legal terms, but it's just really because we're taking your word for it. When you sign that document, you were basically telling us that you were telling the truth. Will everybody do that? We know that not 100% of people are going to be honest, but for the greater good and the greater population, that will be fine for us to receive those attestations from you. Let's move on to the next. There was also the question about accessibility, and just wanted you to know that as far as our county system for our vaccination sites, they are all ADA compliant. I can't speak to every single provider in the community as far as knowledge of this, but at least for all of the county system vaccination sites are. And these are, and when I talk about the county sites, I'm talking about the stationary vaccination clinics. We do have some pop-up clinics that, again, they're just taken to various locations, and we take them to populations that perhaps are at highest risk. There may not be always the degree of ADA compliance. We do as best we can for the pop-up clinics that we set up, and for the most part they are. But I just don't want to put that out there that it's 100%. But certainly for every one of our stationary vaccine clinics, we ensure that individuals with any disability can, as you see, safely and comfortably access the site. Each site has designated parking for anyone with mobility challenges. Wheelchairs are available as needed on site, and there's allowances for observation and minimizing distances that people have to travel between stations. We noted that our Valley Health Center at Tully Road might be considered for those with concerns or developmental disabilities, mainly because some people have said it's just a kind of a quieter place to receive the vaccine, and then there's some privacy involved with the rooms that they use. Again, all of the stationary sites, though, are ADA compliant, but we just thought we would point out that particular site. And let's go on to the next slide. So I just wanted to indicate where our weekly sites are located and a schedule for them all. A lot of them require appointments, and some of them don't require an appointment. So we hopefully make it easy for people, knowing that not everybody has the capacity to do the technology required to get online and make the appointment. You can also call 211 and get information, and that will help. They will help you access a site. You can also visit our website at sccfreevax.org. It's on the chart there, and that will take you to any of the sites that you are close to you that you might want to go to, and allows you to actually make an appointment for the county sites. And if your provider is a provider that's not the county provider, there's also a button to push so that you can go to that provider's site and get their information for signing up. So I don't know if that was our last slide or not. Yeah. so maybe I went over my time a little bit, but there's a lot of information in vaccines and administering vaccines and eligibility and understanding about them and the safety of them and whatever. So I wanted to provide all of that, and now I will turn it back over to our sponsors.
Okay, I thought Maria was going to come back on, but this is Sherry Burns with Silicon Valley Independent Living Center, one of the co-sponsors for today's town hall. And I want to thank you, Dr. Fenster-Scheib, for your opening remarks and helpful county updates for our upcoming vaccine access for members of our disability community. Now we'll go on to our Q&A, as lots of participants today have either submitted questions ahead of time or placed their questions in the chat. As you know, Dr. Fenster-Scheib, people with disabilities and their loved ones are very concerned and understandably emotional about vaccine access, as many are much more susceptible to serious complications and death from COVID. So this discussion today is of utmost importance and very timely. First, many of the participants on this town hall have family members with significant autism, Asperger's, or other intellectual or developmental disabilities. Are people with IDD disabilities other than Down syndrome eligible for a vaccine under the next group in phase 1B?
Yeah, as I said, you may not see everybody, every chronic condition or just in general, every condition on there. And we're waiting for some additional guidance from the state. But so if it's not on there now, I think as we get closer to that, we will have, I'm sure we'll be adding additional conditions to that, but it's not up to me what goes on there. But I think we're going to be pretty open to most of the chronic conditions as we move forward, but that will change. It will be reviewed and revised. And I think that was just their first try at putting down those chronic conditions. So stay tuned, we'll know more soon.
Okay, thank you. Our next comment and question addresses numerous concerns that were raised in the chat today. In many ways, California is behind other states like Ohio, New York, New Mexico, and Oregon in offering vaccines to the IDD communities. On March 15th, our population will be competing with all the phase 1B groups to get an appointment. While it is much appreciated that California finally took action to prioritize our highest risk populations to receive the vaccine, they may have to wait months. This is a population that also cannot tolerate waiting for long periods of time at a drop-in site. The question is, would Santa Clara County consider offering specially identified clinics just for the IDD population? Drive-through sites and mobile clinics would also be very helpful in minimizing the anxiety and behavioral challenges sometimes associated with individuals with IDD. These solutions have been successful in other counties in California as well as other states. Your thoughts on this?
Yeah, thank you for that very much. So, because I think that's very helpful. And we've been taking each of these eligibility groups as they come and trying to listen to the community. We have a number of people working on our stakeholder community working groups to give us just this information. We don't necessarily say that we know everything about how to roll this out, but we were very interested in listening to those comments, and we would certainly ask for your help in trying to make it easy and these sites accessible as best we can. I would say, though, as far as the amount of vaccine, it's increasing by the week, and so we're hopeful that that as we move through the next weeks and couple months, that there'll be a lot more vaccine available to our communities. And right now it's like a supply. There's a high demand and a low supply, but that's gonna improve quite a bit with the rollout of the Johnson & Johnson vaccine. We'll have a lot more vaccine in the coming weeks. So hopefully the availability of the vaccine will be much easier. But I think those access issues that you talk about, I think we have to listen to those things and work with you and your communities to try to make make that work for all of us. And so I think Rhonda's on the phone and Jennifer, and I think we'll take back that information so that we're very, very sensitive to your needs.
Great, thank you so much. There's a couple of questions about folks that have teenagers that are not quite age 16, but they're going to be returning to school soon. And otherwise, they might be eligible for a vaccine beginning on the 15th of March, but they won't be 16 maybe until May or June or July. So have you heard anything about when vaccines will be available for those that are under the age of 16?
So as I mentioned, both of these vaccines, in fact, all three of the vaccines are for older teenagers, 16 and older, and actually the Johnson & Johnson will be 18 and older. And so we are still waiting for the trials to be completed, and that might be quite a number of months for that 12 to 15 age group that they have now just started to test on and to access information on. So those trials are ongoing. I don't know when the exact time is, but it's going to be some time before we see those vaccines available for under the 16 age group at this point.
Okay, thank you. Also here we have a question. Someone has a son with cerebral palsy. It's severe. He also has a seizure disability and a developmental delay. How will they access an appointment for, again, to accommodate people with a variety of healthcare and disability accommodations?
Yeah, and those are great questions. And I think we have to take back all this information and additional information about accommodations and making sure that we are set up and make it easy, and that we have worked through, whether it's a special pod where we have just concentrated efforts on accommodation and access, I think might be the way to go. But help us with that. I'll look to Rhonda and to Jennifer from our team to take back that information for us. So thank you for that. And again, if you're a provider, to these children, family members, please get yourself vaccinated, because again, by getting yourself vaccinated and protecting yourself, you're less likely to pose any risk to somebody who you're providing care to in your household.
Mm-hmm. Okay, thank you. Lots of questions about documentation. You had mentioned that we, with this current phase 1B rollout since the 28th, plus this next group on March 15th, that a self-attestation was only going to be required along with proof of residency and age, if that was a factor. Are there any documents that folks will need to bring other than that to show that they feel that they belong in this category, especially since there's not very much detailed information at this point coming from the state as to who all is allowed in this group?
Right. So we've kind of wrestled with the whole idea of documentation. You can imagine looking at, say, the chronic illnesses and conditions later on. We can't ask people to go and get a note from their doctor. That's not feasible. And we don't expect you to bring medical records. So it's going to be pretty much an attestation that you tell us that I fit into this category. If on the other categories you have information or you have some type of documentation, it doesn't hurt to bring it, just so to make sure that as you provide that attestation, you also have something to back up. I don't think you'll necessarily need it, but I would just advise you to bring whatever you may have to your appointment, just in case.
Okay, thank you. We have another question. The person is a parent of a San Andreas Regional Center consumer, and her sister lives in another county but provides caregiving and respite services for their child. Could the sister be eligible as a in-home healthcare worker and receive the vaccine?
So the sister, just to clarify, is it, so the sister is actually providing that care in our county?
Yes,
Yes, so
but
then.
she lives in a different county.
That's okay. So remember I said, so live or work. So she's living outside, but she's working here. So then she's eligible since she's working in our community.
Okay, excellent. Lots of questions about, and I'm not sure that if you're able to address this, but about regional center clients. Again, proof of eligibility, where can they receive their vaccines? Lots of questions about folks that belong to the regional center and where they can best receive vaccines for their child or adult children.
Right. So number one for them is, so again, if they are providing care, then they fit into that phase 1A. So then just go onto the website and find a place and get yourself vaccinated. If the individual who is being cared for fits into, well, if they're using the criteria that's not quite up and running yet, the chronic conditions category, we have to wait a little bit for that. If yeah, I'm just trying to think of what other category they would fit into. Probably it's the provider that would be eligible right now, and that the actual family member or person you're providing care for would be eligible as soon as we move into that chronic condition category in the middle of the month.
Okay.
Did I answer that question?
Yes, I think if
they,
the regional centers have been providing letters from CDSS, I think for family members that are primary caregivers.
Yeah, absolutely. That's all you need. Make yourself the appointment. Go to that sccfreevax.org and find an appointment. There should be plenty out there.
Okay. Another comment here, the state guidelines address people with developmental disabilities that meet one of 3 criteria currently. The individual is likely to develop severe life-threatening illness or death from COVID-19 infection. Number 2, acquiring COVID-19 will limit the individual's ability to receive ongoing care of serious vital to their well-being and survival. And number 3, providing adequate and timely COVID care will be particularly challenging as a result of the individual's disability.
Yeah.
Can you talk more about these specific criteria?
To be honest, I cannot. I don't, it seems to me that a lot of that is an attempt to really try to be as flexible and as open as possible. So it sounds like many people in this community would meet those criteria. So perhaps it's best to talk to your own provider, your own medical provider, on specific questions that you might have of the person you're taking care of. But I think that's made, I think it's pretty broad when you look at that, of what you just read, of being very inclusive of the community that we're talking about.
Yes, I think a little bit more detail so people can have a self-understanding whether or not they fit into that classification.
And the reason it's not that I don't know, it's just that we haven't been provided some updated guidance from the state. So as I said, we're expecting some clarification, but if anything, we want to be more flexible and be more inclusive than to turn people away. The idea is not to turn people away at all. I think right now we're fighting the issue of not enough vaccine for the people that want to get it, and that's changing. So, soon I'm hopeful there'll be plenty of vaccine for everybody, but this is just a supply and demand issue at this point. But we want to be inclusive as opposed to exclusive for all of this.
Right. Okay, good. This one question kind of goes back to what we started with, was with regards to accommodations, perhaps different specialized clinics or sites. This person says they've watched people with autism struggle waiting in long lines at the fairgrounds with their caregiver who's going to get a vaccine. Is there any way that the county would allow caregivers and their care recipients to receive the vaccine at the same time, instead of having to make 2 trips?
Yeah, so yes, we're working on that. We've heard that, and we're trying to work through that, so it makes it much easier. And again, the accessibility, we want to learn from you and make sure that we have thought through everything as far as making it easier for individuals and their caregivers to be vaccinated.
Okay, thank you. How about teenagers and adults with autoimmune conditions? Do you recommend in general going ahead with the vaccination? What would be certain considerations to address not receiving one of these vaccines, especially that the Johnson & Johnson is different? It's not a DNA-based vaccine. So are there any concerns about folks with autoimmune conditions?
Not that I've seen. I mean, they certainly tried to incorporate a number of various types of chronic conditions, including autoimmune disease, in the trial studies. And I haven't seen any contraindication to any of those. In fact, we certainly want people to get the vaccine, to get the protection so that the chances of getting the actual COVID infection are diminished quite a bit, so that the benefit far outweighs any risks. And at this point, it doesn't appear like, unless you have, as I mentioned, some severe anaphylactic reaction to vaccines in the past, that there's no other contraindication to these vaccines. Again, very safe and effective for pretty much all of these chronic conditions.
Thank you. A question about Blue Shield now taking over through a state contract managing the vaccine distribution and registration. How can we ensure that we will have access based on the disability criteria? In other words, how much autonomy perhaps might Santa Clara County Public Health have in determining the methodology for distributing the vaccines with Blue Shield now taking over?
Right. So for people that don't realize that, the state has decided that they would have a third-party administrator. They call that a TPA, third-party administrator, and they decided to use Blue Shield, an insurance provider, to take over all of the allocations of the vaccine in the entire state, which would mean pretty much public health may lose all of our oversight or control over the things that we've been doing in our community. And we're very concerned about it. I can be very public in saying that we're very concerned about this happening, and we need to maintain all of that everyone has worked so hard to put together. So we are in this, what's called the third wave of their rollout, which doesn't take place till later on in the month. We will be having discussions with them, and we are working very hard to make sure that we can assure that all the work that we've done and everything that has been put in place to provide access and work towards the highest risk and focus on the highest risk communities is maintained. And so we're going to be fighting for it. The bottom line is I don't know what the outcome will be, but we're working hard to make sure that we don't lose what we have already built within our community.
Okay, great, thank you. Question about, again, some folks within the IDD population or perhaps other disabilities are unable to wear a mask. And if they're going to a vaccine site, is there another protocol they can use to protect themselves as well as other folks around them without wearing a mask?
Yeah, so that's a very good question. We basically are all we're all in masks, and everybody is in PPE. So perhaps the main issue is really going to be potential exposure to other people that are coming to get their vaccine, as more so than just the person providing the vaccine to you, because they're in full protection. So I'll take that back, but I think that can be worked through as far as taking somebody out of the line and providing them a safe way of not using a mask and getting their vaccine. I think that's very doable. And at each of our sites, we pay attention to people that have special needs at that moment. So it's very doable. Don't worry about not getting vaccinated because of the mask issue.
Okay, great, thank you. This person writes that they have a 2-year-old who is autistic, and they want to know when she and her husband are eligible to receive a vaccine.
So if they're providing care, it sounds like they're caregivers, and so you do fit into what we've just talked about under the phase 1A as as a care provider. So you're eligible now to get a vaccine because of your care of that child.
Okay, and under phase 1A, there was documentation that was required often. Is that no longer, is it a self-attestation at this point?
Yeah, yes.
Okay, great, thank you. Okay, what do we have here? And you addressed the fact that county is allowing now people who work in this county but live in another county, that's fine. If they can indicate that.
Yeah, remember phase 1A, the health providers or the sectors of occupations. The only place that we require you to be a resident is on the age category. So 65 and older, we've been allocated vaccine according to our population of people 65 and older, and that's the reason we need to vaccinate people that are residents by age. All the other ones are work or live in this community.
Okay, very good. We have a person who wrote in that they're a parent of a 12-year-old that has mental health disabilities and is living in a residential center. He comes home periodically and will be coming home later this month, would like to be vaccinated. The parent would like to be vaccinated, especially as they will be traveling to take back and forth to the residential facility. What kind of documentation do they need to qualify for vaccination? And does it need to be from a doctor? They're not involved with the regional center. So that's what they're asking.
Yeah, yes. So again, the fact that they're a healthcare provider for a family member in their home in this county, again, it would be that self-attestation if there's no other way of getting any type of documentation. We're trying to make it as easy as we can, and we just depend on your truthful statements under the attestation that that's the story. And so we will accept that. We're trying to, again, make it inclusive and not put up barriers for people. We want people to be vaccinated. So again, it's supply and demand. If we had all the supply that we needed, we wouldn't even be having this conversation probably. We would just say, everybody go.
Okay, this next question is similar, and I think it goes back to your statement perhaps that you made about the 1B group now that we are beyond the initial vaccination of that group and requiring documentation that self-attestation is okay. This person wrote that they were told that they didn't, their other family members that live in the same household providing care to their son who has a developmental disability. So in other words, that they rotate who's responsible for providing care. We're told that they didn't qualify for the vaccine because they weren't the quote unquote primary caregiver of the parent. Was that an inappropriate turn away, or has that situation changed now that we're into 1B?
Yeah, I don't know what happened at that particular site. So I'm not aware that we're asking for primary care providers only. I think it's if you're providing some care and you're going to have some contact, not that you're totally separated all the time from this person. If you were actually providing some of that care, then you're included. If you're not providing that care, then you're not a care provider. So you just have to determine who is providing the care, and then they are eligible.
Okay, great, thank you. This one brought in, with the expansion, we are expecting Kaiser Permanente to offer its members more opportunities for vaccine appointments, or are they still adjusting the categories based on vaccine availability? If we need the vaccine sooner, should we still just go ahead and range this through one of the county locations?
Yeah, so you bring up good points. I didn't go through all of this, but the county gets an allocation and we distribute it out to the providers, except for the real big providers who are called multi-county entities, or MCEs. That's Palo Alto Medical Foundation, PAMF, and Kaiser. So they get their own vaccine. We're not involved in their allocation. Unfortunately, they just haven't been given enough vaccine. So their cadence has been much slower. They're going to vaccinate, and they've sent out notices about vaccinating teachers so that they are moving along. And we believe that they are going to be getting sufficient supplies of of the vaccine. So start with Kaiser if you're a member, and if that just doesn't work out, then you can use one of the county sites.
Excellent, thank you. And I think we have time for one or two more questions. This person writes in, our supported living service providing staff that are going into homes of people with intellectual or developmental disabilities and providing them with independent living skills training. Are they eligible for vaccination either under 1A as a healthcare worker or under 1B as emergency services?
Probably more so under the 1A. So I would say yes, they are. More so, it seems to fit more under the 1A.
Okay, very good. Lots of questions about documentation, which is good that we don't have documentation being required at this point for the next rollout.
We didn't want the message to go out that everybody thinks you don't have to bring it. You know, we would bring everybody from anywhere because they say, oh, Santa Clara doesn't have anything as far as documentation. So if you have something, please bring, which would help us. But ask you to sign that attestation. So that is a form of documentation, that attestation. So the wrong message getting out to the surrounding community that just go to Santa Clara, they don't ask for anything. So again, we do, and the vaccine that we're allocating to us really is in support of the people that live or work in our community.
Great, thank you so much. Okay, we are at 12:57. We got through a lot of questions. Thank you so much, Dr. Fenster-Scheib. And for everyone who is participating this afternoon in our discussion and submitting your questions either in the chat or ahead of time. And I know that the county staff will continue to answer some of these questions live, and we'll also be getting back to many of you, but we got through a lot. So thank you so much. Really appreciate your time and your presence here today and helping our community be more prepared and understanding the rollout for the next group. And we continue to appreciate the opportunity to work with you and your team, Dr. Fenster-Scheib, in order to make the rollout smooth, especially for this population of people with significant chronic health conditions and disabilities.
And I would just say thank you. Yeah, I would just, again, sorry to interrupt you. I just say thank you for the opportunity to do this. And we learned a lot, and we know that we really have to pay some more attention to make sure that our rollout and our access for this community really is smooth. And we listen to all of those great suggestions for making sure that happens. Thank you.
Wonderful. Thank you too. And I'm going to send it to you, Maria.
All righty. Thank you so much, Dr. Fenster. Santa Clara County website and need help getting an appointment, or you're supporting someone who needs assistance, Healthier Kids Foundation has staff who can help you. There's no charge. They have staff English, Spanish, and Vietnamese.